The patients that we've seen come to our support group have you can see them trying to piece together their story, like what happened to me. That was kind of the beginning of what motivated us to contact you or to look, how do we provide support for these patients, was seeing kind of over and over again the pattern of, wow, this happened, and watching them try to process through it and put their story together.
Welcome to the Medical Trauma Support Podcast, the show where we shine a light on the hidden impacts of medical trauma, explore tools for healing, and empower you to take control of your health journey. I'm Sarah, your host, a passionate advocate for trauma-informed care, somatic healing, and compassionate conversations. I'll bring you expert insights, healing strategies, and personal stories of resilience to help you feel seen, heard, and supported on your path to recovery. Hello, everyone, and welcome back to the Medical Trauma Support Podcast. Today, we're doing something a little bit different that I'm actually super excited about, and I have 3 guests instead of 1. So I have Kirsty, Crystal, and Pam, and they run the heart failure support group at the Christ Hospital Health Network. Hi, y'all.
Hi.
Hello.
So I was wondering if there's anything extra you want to share about yourselves. And after that, I was hoping that you would talk a little bit about the support group that you run, why you run it, and we'll start there.
Okay, sounds good.
Well, my name is Pam Colton, and I am the manager of the Advanced Heart Failure Program at Christ Hospital. I've been a nurse for about 27 years or 28. I don't know. I can't remember. But in this role for the last couple of years.
Okay. I'm Crystal Cornell. I'm another heart failure coordinator here at Christ Hospital. I've actually been at Christ for my entire nursing career. It's going on 20 years next year. And I started out on a telemetry floor, worked a little bit in outpatient cardiology, and I've been here probably about 3 years in this position, going on 3 years November. Yeah.
My name is Kirsty Reed. I have been a nurse working in direct care at the bedside for the last 8 going on 9 years. I have been working on the Christ Hospital's dedicated advanced heart failure treatment floor. And recently, about 2 years ago now, added an additional position as a heart failure coordinator. So I feel that I have a really unique opportunity to be that middleman that truly represents what I'm seeing inpatient with our nurses and our staff and what patients are experiencing while they're admitted in the hospital.
Mm-hmm. And all 3 of you are the 3 nurses that run the support group.
Yes.
Yes.
And when did you start it? When did you start the support group?
So I wish I could take credit for starting it initially, but I think that the support group has been probably around since about 2012, maybe 2013. So when I came into this position, that was right after COVID. So the whole world had shut down and things were just starting to open back up again. And I was new to the position. Actually, Crystal was with me in the beginning phases of reopening and restarting the support group. And so I wish I had a date for when we restarted it, but it was when things are opening up back up and people were still pretty afraid to come out and interact with other people. But we just decided it was time and we needed to get things started back up again.
Yeah.
So that was probably
It would have been 2022.
And y'all have people come in that are still in the hospital getting medical care, and then people coming in to the hospital for the support group that are at home.
Mm-hmm.
Yeah, so we hold it in the classroom on our inpatient dedicated heart failure unit. And we try to reach out to patients that are inpatient thinking that, this is probably some of the hardest days of their lives. And the idea of a support group, especially for somebody who is not familiar with one, sounds, a little scary.
Mm-hmm.
But the idea that if we can encourage them to attend while they're inpatient, that they can form some community and relationships, and they can also get some hope from the patients that are coming back in that have been there and are now out and doing better and well.
Yeah.
So that's kind of a unique part, I think, of what we do.
I think the hope piece that you talked about is so important. And it's partly why I started this podcast, is because a lot of people I've talked to on this podcast are people who've been through really challenging experiences, and they're, years into recovery. And so like people listening to the podcast who may be in some of the hardest days of their lives are able to say, oh, wow, this person was where I am now, and they're further ahead of me in recovery. I think that's so hopeful. I know as a fellow human, I find that really hopeful to like hear from other people that are ahead of me on their different journey. But you were also saying, Pam, y'all have this group at another hospital, or you have patients from another hospital come to this one?
Our support group is not specific to Christ Hospital. Any patient going anywhere could come and attend our support group. But as a result of feedback that we received from patients, though, we've also started a second group at it's like North Cincinnati location, just because we heard that the need was there.
That's amazing. And I'll let listeners know that I got a chance to come and speak to your support group about medical trauma. I thought it was amazing that y'all were thinking about that to the point that you're like, you know what, let's bring somebody in to talk about this, one of these aspects of the experience, and that is experiencing some medical trauma, which I don't think is unusual when people have experienced cardiac events. They can be really scary. I was really moved by you reaching out to me to say, hey, I'd like to bring this in and have our support group get to have this conversation. And then the other thing that I was really moved by was when I was talking to the patients, and they kept coming back to the compassionate care that they got from y'all. And so that, I've talked to many, many people who've had really challenging medical experiences, and not everybody gets that kind of care. Not everybody gets that kind of compassionate care where they just keep talking about how special y'all are to them from that experience.
I think with heart failure, it's kind of unique too that it's such a chronic disease process that a lot of these patients are in the hospital frequently. They come back. We have a dedicated floor where people deal with VAD patients. So they're in here a lot. And the nurses, the bedside nurses, not just us, get an ability to get to know them on a personal level. They get to hear about their story outside, how they've been since they've seen them last. So I think it's a unique population too. And then I personally, my outpatient experience has helped me to hear the stories of people after the hospitalization, where a lot of bedside nurses, they see patients for like a one and done type of thing, right? They've left. They never get to hear the story after of how that felt to them. So I think in a broad general aspect for healthcare workers don't understand the trauma that can happen, where here with that chronic disease process, they get to see that.
Yeah. And when you talk about outpatient, are you talking about this support group in particular, or are you doing other outpatient work?
Previously, before I got this position, I spent about 2 years in a cardiology office. So it was like they were my family almost. I was calling people weekly. So you'd hear their stories after hospitalization, how they felt, if they felt they were mistreated or if they were happy about what happened. So you get to take those things back sometimes I get to use that in what I do now.
Yeah, that's amazing. What a beautiful perspective to be able to talk to people when they're out of that like really acute crisis period, because a lot of times what's happening there is they're not processing what's happening. They're getting through a really scary experience. And then it's like, once you get home, that's a lot of times when the emotional stuff starts to really come up. And not everybody has the support. They don't have the nurse showing up, when you're inpatient, you have a nurse showing up and checking on you. And when you're home, you don't have that. And a lot of people don't have mental health care. And so they're really struggling emotionally after such a scary event.
Yeah. And actually, Sarah, that's something that we have heard a lot. We work for an amazing system. They do amazing things. I actually just read and I was like, oh, wow, that's an interesting thing, that our hospital system actually provides access to every major cardiovascular intervention technology introduced in the past 25 years. We really do work for an amazing system. We have earned the reputation of being the heart hospital of Cincinnati. And we do LVADs or left ventricular devices. We became a heart transplant center at the end of, I think, 2022. And then we've just done transplanted, I think one of the first few in the nation of artificial hearts, which is amazing. We do amazing things, but with those amazing things that we do, I mean, there comes a lot of emotional processing, a lot of trauma along with it, just quite frankly. I was thinking about this last night is, when we talk about trauma, if you Google trauma, it comes out physical trauma, but not medical trauma. And what does that mean? Not the psychological trauma. And it doesn't even necessarily mean that the healthcare team has done something wrong or missed their mark. It's just being thrown into a situation where you are helpless and it's typically unplanned and you are out of control and things are being done to you. And how traumatic is that? One of the things that we heard over and over again, specifically from our patients who can be hospitalized for a very long time, especially if they're being worked up for an LVAD or for a transplant, they're usually very, very sick. And the patients that we've seen come to our support group have you can see them trying to piece together their story, like what happened to me. It's really, that was kind of the beginning of what motivated us to contact you or to look, how do we provide support for these patients, was seeing kind of over and over again the pattern of, wow, this happened, and watching them try to process through it and put their story together. And, just to go back to kind of what started the conversation was one of our patients said, when I went home, it was like when I was here, there was everybody here. Then I went home and nobody was there to call. And almost like him when he has come back to the hospital, that's his safe place, which in my mind, that doesn't necessarily make sense because I'm like, I wouldn't want to be in the hospital, but it would, I think, if you felt like your life depended on it. So I think that conflicts too, right? You've been through this long traumatic experience. And glad that you're alive, but yet there's all of this trauma that goes through that you're going through, and a fear of living without the support. So I think it's very complicated.
It is incredibly complicated. I think that's something that makes medical trauma different than a lot of other traumas is there are so many other layers to it it'll take me a long time to go through all of them, but just the fact that you walk into a place to get care, right? Oftentimes that care is traumatic. If something is like life or death situation, when you're talking about the heart, that is a life and death situation. So you're walking into a place to get care. It's also traumatizing at the same time. There is a vulnerability to needing life-saving medical care that is really challenging, a lack of control, like you talked about. And then when somebody hasn't had a good experience and they didn't feel seen and connected with, it's like that impact is so intense, I think, because of what has led up to it. Like you're walking into a place, you've experienced a life or death event, you're vulnerable. You may be in, like you said earlier, some of the hardest days of your life. And what we really need then is somebody to come in who's like attuned and compassionate. And then you bring in the system. And not every system is taking care of the people working in it. And so when you're going in and day out and you're not cared for, and it's almost like you're just like the system's taking everything it can from you, I think it is impossible for anybody to show up attuned and compassionate in those systems. And so one of the questions I had for y'all was, clearly you're in a system that is taking care of you, right? To the extent that you're able to run the support group, you're able to show up in this loving way with your compassionate way with your patients. I'm curious about that. Is that even true? Is what I said, does that actually feel true to you? Or do you feel like you've had a different experience?
I mean, I think like every hospital system, we struggle. I mean, you struggle with staffing issues and, every rules changing. I would be dishonest to say that, we don't struggle with those in our hospital. I think that And Kirsty probably would agree with me there. But I think that we're lucky in that we have these positions that we have and that our leadership has supported it, and not just supported it, but supported the growth of it. So it was just myself and Crystal. And then because our leadership, because of their support, then we were able to add Kirsty to make sure that we can, because not only do we facilitate the support group, we do patient education, we do outreach and a lot of things that their support is what, yes, allows us to do that. It's what it has allowed us to show up at the support groups and to expand it.
Yeah. That's amazing. It sounded like Crystal, I don't know if you also wanted to share something along those lines.
Yeah, I think that too is the system. There's a push for trauma informed care. We do Schwartz rounds too, which takes care of the staff. They meet, what is it, quarterly, I think.
I believe so, yeah.
So we have one next week even where it's just staff that comes together and talks about things that happen that are stressful or trauma that happens with staff, because it is hard to watch the things that we see.
Yes.
So being able to have a voice there and express those fears and know that you're not alone then, right? Because then that opens up a conversation with everybody else. And then also, there's small groups working all over to try to help with, self-care. We have nurse education events where they talk about that, getting enough sleep, getting enough rest, taking care of yourself, checking your ACEs, like your
Yes.
adverse situations. And so I think there's a lot of work in separate areas going toward that.
Wow, that's amazing.
And I think we're lucky. We in Cincinnati, we are one of 3 other major healthcare systems in the area, and Christ Hospital is a standalone. And I think that does make a difference. You get to know the people here. A lot of the people that are here have been here. They were born here. They went to school here. They've spent their entire career here. And I don't think there are very many organizations where you see that. And I think that matters a lot too. And in fact, I guess I've been with Christ for, it's maybe 8 or 9 years. And, I always heard, oh, Christ is the best. And having been a part of it, it has definitely like a family feeling, and you feel supported. And I would say that comes straight from our leadership down, that we feel heard.
Yes, I think that's beautiful. I think people don't understand the impact that has on the patients as well. The work, when a system puts care and resources into the medical providers, it has such a huge impact on the patients. And we have, right now, we're just talking about your hospital, the 3 of you, and this support group, but it's literally the perfect example of a system that is talking about self-care, a system that is creating peer opportunities for y'all to get together and talk about the hard things that you see as medical professionals. That's huge. And that's not happening everywhere. I'm sure y'all know that. And just the feeling that it's a family and people are caring for you is amazing. And then I think we know from what the people in your support group were saying when I was able to join you for that one group session, just they had so many wonderful things to say about their experiences with the nurses there. I hope people listening who are maybe in a system and have some resources and power to make change will see that patients are a lot happier, right? And I know that that's a metric that systems track. There was something else y'all said that I want to learn a little bit more about, and that was you talked about the patient education and the outreach, and I would love to know a little bit more about what that looks like.
So I'll go ahead and speak to our patient education process. We will typically identify patients who are admitted currently in the hospital, who are here for acute heart failure or congestive heart failure or a heart failure exacerbation, or even some patients who are planning to get implanted with an LVAD this admission. As Pam had mentioned, the left ventricular assist device, because even after they go through this very intense and traumatic surgery, they're still going to have heart failure after being implanted with this device. So we will either identify patients who have had frequent admissions.
Mm-hmm.
We will often recognize their names because they're here quite a bit, or we have providers who reach out to us, specifically the APPs or even some of the nurses. And then we also collaborate with our cardiac rehab program to identify patients who have those educational needs and really need that one on one time and patience and kind of like really catering to them and meeting them where they're at. I love to, start a lot of my conversations with my patients because it usually turns into kind of more of a dietary consult, it seems, because the low sodium diet is pretty important for our patients. I like to ask them, like, what do you like to cook? Like, I try to identify something that matters to them and incorporate that into how I educate them as well, because I want them to feel heard. I want them to be successful. And me telling them you can't do this, you can't do that, you can't do whatever is really limiting.
Mm-hmm.
And no one likes to hear you can't do that. So I like to try to flip the script and talk about, well, what can you do?
Yeah. Yeah, it's a really human way to be with people, like recognizing somebody else's humanity and that they are this whole person who is not only a person with heart failure, but they're a person who has foods that they like and activities that they like and people in their life that they love. And I think that's really beautiful.
I read
You
a
know,
statistic that basically said that patients are only spending what, like 1 to 3% of their lifetime with us, if even if that. It's the time they spend with us is so significant, and how we're able to capitalize on that really small amount of time to improve their time by themselves,
Yeah.
because we don't want them to be here. We want them to be at home and thriving and have a really great quality of life. But with chronic disease, quality of life can be really limited.
Yes.
and it's interesting. We partnered with, well, we are lucky that within our hospital system, we actually have a unit that's a hospice unit. And one of their social workers does a lot of work on grief and grief outreach. And we were lucky enough to invite her as well to one of our groups, because the interesting thing is when you're diagnosed with a chronic illness is the grief that comes along with it, right? Whether it's grief over, oh, I can't eat this, or grief over, I love to get out and run and I can't do that anymore, or grief over, like, you name it, right? Grieving the life you had and now this is the life you're going to live, and there's a ton of grief that goes with it. And so I think that I would say that was an eye opener for me, actually,
Yeah.
especially in our thought process on how we educate our patients. Like Kirsty said, instead of telling them what they don't do, I was like, oh, we really need to flip the coin on that and talk about what they can do. And you know what? It's a balancing act, because they come into the hospital, like Kirsty said, you only have a little bit of time with them, and there's a lot of information that you need to get there, but trying to educate them in a way that not only is like you're going to be able to listen to it, which I would say in the hospital is probably not the best time for any education, honestly,
Yeah.
but absorb it, but then not leave and feel so defeated. Like, well, what is the point, of moving on here? But we
Yeah.
do a lot of education. Kirsty and Crystal do most of our patient education inside the hospital, and they do a great job. And they are allowed to. They have time to do that. We divide it up to make sure that they have the time that they need to spend with the patients. So it's not just a, hey, we're gonna come and talk to you for 5 minutes and leave. They actually get the opportunity to sit down with them and have a discussion and form a relationship with them, which I think is really important. And Crystal does a lot of organizing for the support group, also for education, inviting and just community resources and people to provide education with the support group. And we usually will try to get feedback from the people who attend it to figure out what it is that they need, how
Mhm.
we can best serve them. So I would say most of our topics probably come from suggestions from them, or something they said that we picked up on that we thought would be a great idea. But we
Yeah.
also do community engagement events to try to lighten the, topic, I guess. We had a cardio carnival, which is going to be an annual cardio carnival. We've decided, but we actually invited a lot of different members of the multidisciplinary team we have, as well as community people out in the community. I think there was like an urban pharmacist, and we had our like behavioral health specialist there. We had just tried to kind of find people that we thought that would be valuable for the community. We brought them together. We actually had it on our inpatient unit to again incorporate, so people inpatient, you could have some kind of engagement there, and also hopefully some hope and
Yeah.
involvement with the resources that are out there. So that actually went really well, except it was a little too crowded. So we're not sure how we're going to manage the crowd next year because it is on an inpatient unit.
Yeah. But I mean, that's like a good problem to have, right? People wanted to be there. So yeah, it got crowded. Well, the thing that I want to go back to a little bit when you talked about, patient education and like in the hospital is oftentimes a really hard time to do patient education, but it's the time you have, right? And this is something that I've talked to people about is how do you prepare? And obviously there are medical experiences where we don't have time to prepare. They're unexpected, but when somebody knows that they're going in for a surgery or somebody knows that they're going in to meet with a doctor, but they know that because of their history of trauma, they may, they're in fight or flight. Their body is not really prepared to be thinking with the executive functioning and remembering everything that is taught to them. And so one of the things that we will talk to people about is, do you have a support person that can be with you and that might be able to take notes? I'm guessing you'll probably have handouts for this reason. But I'm curious if there's any advice that y'all have to people who have an upcoming procedure or even an upcoming appointment that they're feeling really nervous about. And they know that they are probably not going to be able to retain the information that they hear at that appointment. I'm curious what you think about people having a support person, because I personally would love to normalize that, that whenever you go to an appointment, you have somebody who you feel safe with to be there with you. But I was wondering if there are other things that y'all do to try to help people who are in this like super sympathetic charge kind of place remember what the education is that you share with them.
We do try to identify patients that might be at a higher level of anxiety while they're in the hospital, and we have them screened by our pastoral service. But then after they leave the hospital, we talk to them on the phone. We'll give those education. And I'll tell them to write down any questions they have, or if they sound like somebody that's, not as knowledgeable, find somebody to take with them. But I think too is key for people start understanding is to be open to your doctor that you're nervous and you're scared, to give them the time to slow down and understand, like, okay, this patient is in fight or flight. Let me take this moment, because they don't always know that. If we're being stoic, right, they think we're in here, we're just the plan. But if you can let the doctor go and be vulnerable in that, they will often slow down and take that time.
And there are some people I've talked to who will literally go mute. Like they get so nervous, they can't even get their words out. And one of the things we've talked about is before you go into your appointment, writing or typing the things you want to ask, the things you want to say. And so it could be that somebody who gets like that brings in a piece of paper that says, I've experienced medical trauma in the past. I'm really scared. Sometimes it's hard for me to get my words out. These are the questions I have, or these are the things that I wanted to let you know.
Exactly.
Yeah.
I would definitely agree with that. I think that, well, anybody who's experienced that fight or flight, you can't think, right? And I think if you know that you have that, definitely writing it down ahead of time, because you know that. And also probably writing the questions down will help get them a little bit out of your head, right? I
Yes.
mean,
Yeah.
it's just like putting that pen to paper and writing it down. Even that is like, okay, I won't forget to do that. But then you have to not forget to give it to them. But I think having a support person, truth is, even if the support person doesn't know anything about medicine, or just having somebody there with you is enormous. And
Yeah.
we actually have a volunteer who she's a certified yoga teacher, and she has been coming to the support group since we restarted it. And she has been actually one of the main champions for, hey, you need this, and for us reaching out to you, Sarah. But she is now offering like mindfulness techniques, workshops for patients,
Wow.
and actually would like to do that too, where she was in the office where she could maybe work with people who have high anxiety. So
Yeah.
hopefully more to come on that,
Mhm.
but there's definitely opportunity there. I agree.
Yes.
But I
That's
think having a
amazing.
support person and writing it down are very important things. And bringing something, this sounds silly, but something with you. I know that sounds silly, but something with you that brings you comfort, you know,
Yes.
I think about, I don't know, it might sound silly, like when you're a little kid and you want to bring your stuffed animal wherever you go, there might just be something you can hold in your hand that can ground you, that can help you there to help calm
Yes.
you.
Absolutely. I think, like you said, like sometimes our culture thinks like that's childish. And I'm like, that's another thing that I want to change is like, how can we, oftentimes I think about this is like, when we are feeling that way, oftentimes we can be really hard on ourselves. Like, why couldn't you just pull it together? Why couldn't you ask the questions? And I think like in these situations where we're really scared, what if we just imagine that we are like the 3-year-old and like the grown up version of us is taking care of us as though it was a 3-year-old that was really scared? And what would we do if it was like a sweet little toddler who was feeling really scared about going to the doctor, really scared about going to the hospital? You would be so kind and you would say, let's get your little blanket, let's get you really comfortable. Let's, after an appointment that was maybe really scary, let's go watch our favorite movie. Or, there was somebody who shared on the podcast a while back that they would have a plan for doing something special after an appointment that they were really nervous about, a butterfly garden, going to the zoo, going to your favorite store. So I think that there are so many like beautiful things that we can do to support ourselves, but we have to kind of sometimes flip our perspective a little bit and think like, what's a really kind thing that we can do for ourselves because it makes sense that we're scared. It makes sense. So I love that idea. Bringing even like a little rock. I personally have fidgets everywhere. I have like 3 fidgets like out on my desk at all times, something like that like just you can channel some of that nervous energy into. Yeah. I think that's amazing. And I also love that y'all are thinking about other ways, like having this person who's a yoga teacher come in and be able to be with people and teach them some different skills is wonderful.
In fairness, that was her idea, but
Oh,
she's amazing, and she has helped us with a lot of things. She's actually taught us some mindfulness techniques, and she actually makes hearts. She calls them hearts of compassion, and she makes them out of with her mom's sewing machine who passed away, and she fills them with rice, and we have them for the patients, and she has a little poem on them, and where we can get feedback from patients on how they use them. It has a barcode. And we've had people say, you know what, I brought him to my dad in ICU and he was restless and he was able to hold them in his hands and it helped to calm him. Somebody else said had trouble getting her twins to go to bed, or one of her twins to go to bed and stay in his bed. And so he has one heart and she has the other. It doesn't have to even be a big thing, but I mean,
yeah.
something that brings you comfort and helps calm you down is could be very helpful, I think.
Yeah. That's really
And
beautiful.
I think too, another important thing that we try to do is bring patients back into our education forums, our symposiums and things so that they can speak, so they can talk about their experience. And that way everybody can kind of hear and be prepared for those feelings that could come up. So that's something that I just wanted to point out.
Yeah. It's really
And that's
amazing what y'all are doing.
Well, I think it's amazing. Honestly, you know what? It's the people in our support group and the connection that they make. That's really amazing. We facilitate it. We have the room, we bring it together, we have a topic, but it's their connection to each other that's really where the growth goes. And honestly, our support group is 1 hour. We always leave an hour afterwards. And actually, sometimes it goes longer, or sometimes people stay after, where I think really it's like some people were talkers during the meeting and some people are listeners. And then in that hour after is where a lot of I think the healing and growing comes from, when they start talking there, when somebody said something that they could identify with that made sense. And so I'd love to take credit. We would love to take credit for all of it, but I think a lot of it is right. The people who come and watching and seeing their connection with each other has been
Yes.
really satisfying, I think.
I just feel like as humans, we are going to go through hard things. And obviously, some people's hard things are really, really hard and really scary. And it's so, I think, like knowing that as humans, we're going to experience hard things, like what can we do? And one of the, I think, most important, like life changing things that we can do is to have supportive community. So, like y'all having the support group, I'm guessing that there are probably people in your group that don't really have much support outside of that group. And then, some other people are lucky and they have super engaged families and big community support. But I have talked to enough people personally myself that I know there are a lot of people out there that are really lonely. They don't have a support system. And so groups like yours are like lifelines for them and just so important.
I think sometimes too, even if you have, depending on what your role is in your family or with your friends, I mean, sometimes, right, you feel like your role is you are the leader, you have to keep going, where
Yeah.
that's not a place you feel, not that it's not safe, but where you feel comfortable that to be able to express your fears and vulnerability and what you're feeling. And I feel like when you in a support group, it's different,
Right.
it's neutral ground where you can share what you're feeling, or even if you don't feel comfortable sharing, you can listen and
Yeah.
get the benefit just listening.
Yeah. And see that you're not alone in some of these feelings that are, you know, a lot of other people are probably having, but you don't know. And that's like one of the things that I talk about a lot too, is I feel like sometimes people come into my group and they say something and all the other people are like, oh yeah. Yeah. And it's like it's almost like at first a little bit shocking, like, oh, it's not just me. There's nothing wrong with me. Like other people feel this. And I just think that that's such a beautiful connective experience of being like, oh, it's not just me. Okay. Well, one thing that I was hoping y'all could share with the listeners is for people who are in your area and may want to be a part of the support group, can you let them know how they would go about joining?
Yeah. They can always call us. We're HeartLink, and that's 513-585-0378. Or they can email us, and that would be at pamela.colton at thechristhospital, all one word.com.
Okay, and I'll share that in the show notes so people are able to access that from there. And I love to wrap the episodes up by asking the guests if there's something that you think is really important that people take from this, like a little nugget of wisdom or something that you want to share. And each of you are welcome to share something if you would like.
For me, the end goal, like to be productive, to put something into action is how can we prevent the drama to begin with, right? So I think that there's a huge opportunity for community engagement and getting out there into the community and maybe getting to the children with specifically with heart failure, but other diseases, social determinants of health, especially with what's going on in the world right now. I think that it's important to hit that community to make a change because we want to prevent it, right?
Yes.
That's the end game. In America, so often we put the cart before the horse. Kirsty
Yeah.
was just looking at some data where our numbers in America are horrible compared to other countries. And I think
Yeah.
that's the goal for me anyway, would be
Yeah.
to stop it before it happens.
Yes, absolutely. That's amazing. Thank you. Kirsty and Pam, do y'all have anything that you want to?
So I think I'm mostly speaking to healthcare providers with this statement, but I think something that was really eye opening for me was listening to our patients speak amongst each other. We don't have a shared experience like they do when it comes to cardiovascular disease, hospitalization. Oftentimes, everyone's situation is different. But I think clinicians need to remember that our patients are feeling vulnerable. We are taking care of them on some of the worst days of their lives, and that we really are here to be an advocate for you. That is not only my job, but my goal for the next 12 hours is to be that advocate for you. And you need to tell me if like I can better advocate for you if you tell me what's going on, and I'm here for you. I will communicate your needs, and my end goal is to leave you better than I found you. Whether it's, just we smiled and laughed today because we both needed it. I needed to take a deep breath too. So
Thank you.
I think I would just say, I think, anytime that you enter certainly the hospital, whether it's expected or unexpected, you're put in a position, again, of vulnerability where you don't have control. First thing we do is we take all your clothes off and put a gown on you. And then, right.
Yeah.
I mean, everything feels out of control. To me, medical trauma doesn't come necessarily because there was something that happened wrong, although yes,
Mm-hmm.
that can be why too. But just that whole experience is traumatic, period, even if you did feel heard. And so I think one of the things that was eye-opening to me during the time that you spent with us, Sarah, was like, wow, the patients thought, wow, there's actually a word for this. And so that, I think, was very validating. And I would say if you have had that experience and you don't have a care team that is validating you and your feelings and supporting that maybe look at a different one, because that's not the way it's supposed to be.
Yeah.
And I agree with Kirsty too. I think sometimes as providers, it's hard for us. We don't have that shared experience with our patients. I think probably most of us who work in healthcare do have some experience, but not theirs, which is probably what created the compassion to make us want to do what we're doing. But to be able to separate and see that, that a patient's experience there is going to be traumatic. I mean, I think I would just expect it to be traumatic and know that there's going to be things that need to be cared for too. Just like if you need follow up for your heart, you need follow up for your mind and emotions too. There was trauma, there was, right, the physical trauma, and then there's the emotional trauma.
Yeah.
And I would say, I think that we in our healthcare in the United States, we can do better. We are working hard on that in our own hospital. We actually just got last few months, I'm working with our behavioral healthcare manager. They approved a position for somebody specific for our cardiology and a few other specialties for support there.
For mental health support?
Yes.
Wow, that's wonderful.
Yeah. Yeah. So I would say kind of slow steps, but we're trying. And that actually came from listening to our patients as well. So, and like I've said, I just keep talking about it. If you just keep talking about it, one day somebody's either going to fire me because they're tired of listening, or maybe something will happen. Yeah.
Yeah. Thank you so much. This was so great to get to talk to y'all, and just the shared wisdom that you brought here. I'm really thankful for it. I'm so thankful that other people will get to hear it. So thank you.
Thank you.
Thank you.
Thanks.
Thank you so much for joining me for this conversation today. If this episode resonated with you, I'd love for you to follow or subscribe to the Medical Trauma Support Podcast. It really helps more people find these stories and know that they're not alone. And if you're looking for a place to connect with others who understand what it's like to live with and heal from medical trauma, I invite you to check out the Befriend Your Body community. It's a supportive space where we explore somatic practices, nervous system education, and peer connection to help you feel safe in your body again. You can learn more and join us at medicaltraumasupport.com. Thank you for listening.